A unified strategy with stroke champions is needed to combat lagging stroke services in Wales, according to a report from the National Assembly's Health, Wellbeing and Local Government Committee. It recommends the clearer allocation of funding for these services and more public awareness raising to get key messages across, such as that strokes can be preventable.
We also want to see the establishment of stroke units at every single major hospital in Wales. It's not right that some people are treated in stroke units and other people aren't. And we also want to see a all-Wales stroke strategy. We think that it's unacceptable that there isn't a focused strategy for stroke victims, and we think that the establishment of one, as we've heard from in the evidence, is absolutely critical to moving things forward and seeing the improvements that we need.
The committee was also concerned at current ambulance response categories, the lack of a register of stroke patients in Wales, and the inadequate levels of training for healthcare professionals engaged in stroke services.
Well, we warmly welcome the launch of the report. Clearly the inquiry that the committee undertook last year was of critical importance to be able to bring public awareness of the situation of stroke in Wales, but most importantly to be able to put some pressure on the Welsh Assembly Government to bring equity across the whole of Wales. We have a situation here in Wales whereby there is a postcode lottery. You have in some areas excellent stroke services and in some other areas extremely poor services, and as a consequence you have even areas where people may not have access to emergency services over the weekend, for example.
The committee agreed to conduct an inquiry into stroke services in Wales following a series of negative reports from the Royal College of Physicians in 2004 and 2006. The report concluded that some of the original concerns outlined by these external audits have yet to be addressed, although some improvements have been made.
I think it'd be nice if everybody had the same treatment that we've had. I feel really sorry that I didn't realise that they didn't have the same treatments all over, you know? So I think, don't you?
Yes, yeah.
The full report from the Health, Wellbeing and Local Government Committee can be viewed and downloaded from our website.